Okay, guys, welcome back to Ikureku TV. If you have not subscribed, please do that immediately. Give us your thumbs up and also share this video so others can get to know what's going on in Italy as I speak now. Now, going straight to the point without wasting your time, they said that individuals are going to be paying money. In fact, foreigners, as I speak, are going to be paying money to get medical aid in Italy now. Okay, it says Italy government to charge foreigners to use health services. I hope you are getting the point now. Government is going to charge foreigners to use health service or health services. Now look at it here. Italy government to charge foreigners to use health service. Okay, I hope that's clear. The government is going to be charging foreigners to use health services. Now let's go into it. The Italian government will charge foreigners who live in Italy a whopping 2,000 euro fee to use the National Health Service. Wow. This one shocked me. Are you ready for this? The laws of Italy is changing on daily basis. The cost will be adopted as part of the 2024 budget. Remember that the Prime Minister, Giorgia Meloni, has briefed the public on the 2024 budget. There will be an unspecified discount for those with legal residency, as well as foreign students and EU pairs. Italy's economy ministry announced in a statement on Monday, October 16th, that it intends to charge foreigners from outside the European Union who live in Italy a fee to use the public health service. The costs are expected to amount to 2,000 euros per year. Those of you who normally goes to hospital, we know the well every time. You're going to pay 2,000 euros per year. 2,000 euros per year. Let's say this government wants to strangle people, immigrants. The charges reported the news agency Reuters will be adopted in the 2024 budget. There will also be an unspecified discount for those who possesses legal residency papers, as well as foreign students and EU pairs, the agency added. According to the ministry's online statement, the budget covers the period of 2024 to 2026. France and Economy Minister Giancarlo Giorgetti said that the new budget was in line with a prudent approach that is responsible and realistic. Now, the Italian government wants to maintain their budget. I think the other time I saw an update where they said that if they don't manage some of the issues that is arising, that they might not be able to sustain the economy. So that is why they are looking for means to get money that will sustain their budget from 2024 to 2026. The minister stated that this government has been concentrating on the extra deficit and wanted to give some kind of relief to the medium to lower earners and their dependents. Giorgetti added that Italy had been feeling the weight of the heightened interest on the public debt, and that some things were not negotiable at the moment, like the price of energy. So every day the price of gas is going up. Normally, in a place where I stay, I'm not supposed to pay more than like 50 euro or at maximum 70 euro. But now, at least, Opekete paid the least is 140 euros. That is what I pay for only light. Okay. Now, additional funding for health. In order to achieve their aims, one of the measures included in the budget, explained Giorgetti, are changes to health provision, as well as the charges the government intends to add funding to the health service, equivalent to 3 billion euros per year in 2024. This will add to the money already set aside to support the Sicilian region and as part of the National Plan for Recovery and Resilience (PNRR), as well as 4.2 billion euros from 2026. Remember that the price of energy has gone up after Russia invaded Ukraine, and Russia was forced to cut the gas that they were supplying to Europe. So immediately that happened, the price of gas skyrocketed in Europe and energy went up. So light is expensive, gas is also expensive. Now, bonuses will be offered to healthcare providers who manage to reduce the waiting list time, and resources will also be allocated in the year 2025 to help regional health providers appoint more employees. Now, however, although Italy provides free public health care and extends this not only to Italian nationals, but also foreign workers, job seekers and asylum seekers, as well as unaccompanied minors, there are some categories of foreigners who already have to pay certain costs. Okay? So pay attention to what I'm explaining to you. For instance, diplomat and foreign students can use the Italian health service, but for a variable fee, dependent on their annual income. So it depends on how much you earn. Okay, might determine how much the country will charge you as a diplomat or as a foreign student who came to this country to study. Reuters reported that student charges are capped at 150 euros per year, but for higher earners, fees can reach as much as 2,800 euros per year. Yes, 2,800 euros per year. Proposals has kicked up some dust. A spokesperson from Italy's biggest trade union, CGIL, Giordana Pallone, told the Italian news agency Ad Kronos that depending on what the details turned out to be, the reform could fall foul of the Italian constitution, which guarantees free medical care for the poor. So tell me how those poor families are going to cope with registering their family members. I don't even get it. 2,000 euros a year. Wahala dey o. We have to wait to see how the law is written, because as it is reported today, it has no value or basis compared to the system and regulations that we have, explained Pallone, writing in the financial news portal Qui Finanza. One journalist said that the government proposal had kicked up some dust. During press conference, according to Queen Finanza, Giorgetti explained that the charges would not apply to those who are registered in Italy and are working, unaccompanied minors, and those who are waiting for their resident permits to arrive. Then who will now pay for it? There's confusion here. These people are totally confused. During a press conference, listen properly. According to Qui Finanza, Giorgetti explained that the charges would not apply to those who are registered in Italy and are working, unaccompanied minors, and those who are waiting for their resident permit to arrive. The new charges will follow in the footsteps of provisions made in a 1998 law, report Qui Finanza. Here, the law stated that foreigners who are registered in Italy and are there for longer than 3 months are not obliged to sign up for the National Health Service, but they are obliged to make sure they are covered with some kind of medical insurance, which means effectively they need private health insurance or they sign up for the National Health Service and are charged a fee. I don't know if somebody is understanding what I mean now. Okay? So those people who have stayed here for long should sign up for this. Okay? Probably those who are new in the country, those immigrants who arrived in the country are not eligible to pay this fee. All right? So as a migrant who just arrived in Europe, of course, there's no way you can get 2,000 euros to come and be doing all this one. Now, potential increases. Even with the discount, the new cost could rise by around 470% for some people, from say 149 euro per year for foreign student resident in Italy to around 700 euros per year, right? Qui finanza. People working as AU pairs could be asked to start paying 1,200 euros per year instead of the current 219 euros, which amount to an increase of 547%, stated the financial news portal. So there were fees attached to it. Now, it went up from 219 euros to 1,200 per year. Italy's Order of Doctors Ordine dei Medici released a statement following the news, noting that Article 32 of the Constitution protects the right of the individual and the collective. The article underlines that medical help must be offered for free to those too poor to pay for it. If non-EU foreigners do not have any money, then they must be helped free of charge. Here we are talking about citizens, but individuals. So in our opinion, the right to free healthcare is guaranteed over and above whether anyone can pay for it or not. That's what some people are saying already about it. Although these charges are not directly related to migrants and asylum seekers and cover all foreigners in the country, critics of the proposals see the charges as another way that the right-wing government is attempting to make it harder to be in Italy without the correct papers. Last month, for instance, the government proposed charging migrants around 5,000 euros if they wanted to avoid detention while their request for protection was being processed, reported Reuters and several other news agencies. Now, let us talk about healthcare in Italy. A study by the Society of Medical Sciences, SISMED, in Italy in 2022 found that though health provisions is provided free in Italy since 1982, Italians have been paying for certain services via a ticket system. You can see a general practitioner for free, but if you have a specialized medical visit, you will need to pay. Diagnostic tests and laboratory tests often comes at a cost, as well as non-urgent care and non-emergency care that do not need a recovery period in hospital. If you want to visit a thermal spa, you also need to pay. However, some patients can get some of this treatment without paying if you have a chronic or rare disease. If you have diabetes, cardiopathy, are disabled, have a fast-growing tumor, are pregnant if you want to do HIV test. These ones, you have to get it without payment. Despite these exceptions, the national daily paper Corriere della Sera reported that the beginning of 2023 that some Italian families were forging medical care because of fears of the costs involved. So this is the update now that we are going to be facing in 2024. So we are going to be watching it closely to see how it comes up and how it is going to be, distributed evenly in the system. All right. So let me know if you can pay that money or you're not going to pay. I'll see you guys on the next one. Thank you and touch the share button.